What happens when our body faces stress and instead of dying, cells start multiplying? Interesting, right? Today, we are going to understand an extremely important pathology topic, hyperplasia. Hyperplasia means an increase in the number of cells, not the size of cells, just the number. And because more cells are produced, the organ or tissue becomes enlarged. This is one of the most important cellular adaptations asked in exams. Hyperplasia equals increased cell number. But why do cells suddenly start multiplying? Let's understand the. So, who gives the signal for extra cell division? The answer is growth factors. When the body experiences stress or increased demand, it releases growth factors. These growth factors bind to growth factor receptors on cells. This stimulates mitosis and cell proliferation. The result? More cells are produced and hyperplasia develops. Growth factors and growth factor receptors are the key drivers of hyperplasia. Now let's see the two major types of hyperplasia. Not all hyperplasia is harmful. Some are completely normal. Hyperplasia is divided into two major types. First, physiologic hyperplasia. This is a normal adaptive response. Second, pathologic hyperplasia. This occurs due to abnormal hormonal or pathological stimulation. Physiologic equals normal adaptation. Pathologic equals abnormal excessive proliferation. Let's first understand physiologic hyperplasia with easy clinical examples. Your body is smarter than you think. It can increase cells whenever needed. In physiologic hyperplasia, the body increases cell number in a controlled way to meet functional demand. This usually happens because of hormonal stimulation, increased workload, compensation after tissue loss. Physiologic hyperplasia is controlled and beneficial. Let's start with the most classic example, breast hyperplasia. Why do breasts enlarge during pregnancy and lactation? It's not just fat deposition. During puberty, pregnancy, and lactation, hormones stimulate the breast glands. As a result, milk-producing glandular cells increase in number. This causes enlargement of breast tissue. This is a completely normal physiologic hyperplasia. Breast enlargement during pregnancy mainly occurs due to hormonal stimulation. Now let's move to another very important example. The uterus undergoes one of the most dramatic changes in the body, and two adaptations happen together. During pregnancy, the uterus enlarges massively. This happens because smooth muscle cells increase in number. Smooth muscle cells also increase in size. So here, both hyperplasia and hypertrophy occur together. Pregnant uterus shows both hyperplasia and hypertrophy. Next comes a very high-yield concept, compensatory hyperplasia. What happens if one kidney is removed? Does the body just give up? No. The remaining kidney starts adapting. It enlarges and increases its functional capacity. This is called compensatory response. The body tries to compensate for tissue loss by increasing surviving cell activity. Compensatory hyperplasia helps maintain organ function after tissue loss. So physiologic hyperplasia is useful and protective. But pathologic hyperplasia is different. Sometimes cell growth becomes excessive, and that can create disease. In pathologic hyperplasia, cell proliferation occurs due to abnormal stimulation. Common causes include excess hormones, viral infections. Although it is controlled initially, some forms may later increase cancer risk. Pathologic hyperplasia may become clinically dangerous. Let's begin with one of the most important examples, endometrial hyperplasia. What happens when estrogen keeps stimulating the uterus continuously? The endometrium starts overgrowing. The endometrium is the inner lining of the uterus. Excess estrogen causes excessive proliferation of endometrial glands. As a result, the lining becomes abnormally thick. This condition is called endometrial hyperplasia. Excess estrogen is the major cause of endometrial hyperplasia. And clinically, this condition is very important. Why should medical students care about this condition? Because it can progress further. Patients may develop abnormal uterine bleeding, irregular menstruation, and in some cases, long-standing endometrial hyperplasia may increase the risk of endometrial carcinoma. Endometrial hyperplasia can be a precancerous condition. Now let's move to another extremely common condition, BPH. Why do many elderly males develop urinary problems? One major reason is BPH. Benign prostatic hyperplasia is enlargement of the prostate gland. This occurs mainly due to DHT dihydrotestosterone. Prostate cells proliferate excessively. The enlarged prostate compresses the urethra. As a result, urination becomes difficult. DHT plays a major role in BPH. Let's quickly understand the symptoms. Imagine trying to pass urine through a squeezed pipe. That's exactly what happens in BPH. As the prostate enlarges, it compresses the urethra. Patients commonly develop difficulty in urination, weak urine stream, frequent urination, incomplete bladder emptying. BPH is benign, but it significantly affects quality of life. One final example remains skin warts. A virus can also cause hyperplasia. Yes, even a tiny virus. Skin warts are caused by HPV human papilloma virus. The virus infects epidermal cells. Its DNA enters host cells and stimulates excessive proliferation. This causes epidermal hyperplasia and wart formation. HPV causes hyperplasia of epidermal cells. Now let's compare physiologic and pathologic hyperplasia together. One is beneficial, the other may become harmful. Let's compare them simply. Physiologic hyperplasia: normal, controlled, adaptive. Examples: pregnancy, uterus, breast enlargement. Pathologic hyperplasia: excessive, abnormal, disease-related. Examples: endometrial hyperplasia, BPH, warts. Both involve increased cell number, but their causes and outcomes differ. Before we finish, let's do a rapid final revision. Let's revise the entire topic in under 1 minute. Ready? Hyperplasia means increased number of cells. Mechanism: growth factors stimulate cell division. Types: physiologic, pathologic. Physiologic examples: breast, pregnant uterus. Compensatory kidney response. Pathologic examples: endometrial hyperplasia, BPH, skin warts. Most important exam keyword: increase in number of cells. And that's hyperplasia, one of the most important cellular adaptations in pathology.
तो दोस्तों इसी के साथ